We're back. This is the Now Morning Show. And every Friday for the past few months, we took a break. We have been focusing on a segment called From Playground to Podium, which is a segment that we do with Marissa Gibson Bailey, sports and exercise physiologist, sports scientist, certified exercise physiologist at that. And today we are going to be looking at elite athletes and some of the ways they may experience poor mental health. Now, this segment is really meant for us to look at sporting issues among young people, children, just ordinary people, how they can grow from 0 to 100, but also how Marissa herself, who's a qualified exercise physiologist, trained and in Cuba and worked at the Olympic site in the U.S., how some of the work she has done can facilitate the work of or the improvement of elite athletes. So, good morning, Marissa.
Good morning, Lisa. Happy New Year.
Same to you. Same to you. I feel like it's been a while since we...
It's been a while. Yes, it has been.
Yeah. So we're talking about elite athletes, and I did that spiel because, we chat all the time, and I always say that even though we're speaking about elite athletes, persons at home can take from it and check themselves as well, right?
Yes.
But what are some of the reasons why elite athletes may experience poor mental health?
Well, for them, the training and performance demands, first off, is one of the key areas that actually contribute to their mental issues, especially those athletes who face public scrutiny and media scrutiny as well. So you can imagine training performance and then the public, then the media, and then there's financial concerns. And then there's sudden and prolonged injuries. Then there is in retirement. Sometimes these are events that happen unexpectedly. So all of these combined or separately can cause or bring on the factor of mental issues for some athletes. If we want to put that in a nutshell, and given this current situation, which is unexpected from since March, it can bring on that level of stress for athletes, and not just only elite athletes, but those within the ranks.
Yeah. No, so Marissa, how does this manifest itself in terms of mental health issues? Is it depression? What are some of the things that you would have seen?
Well, the mere fact that there is no certainty of when they're going to compete or even where they're going to get monies from.
Right.
It for me, looking at it, it really hampers performance, because you see it physiologically in when you look at even saliva samples or even in the urine samples, you do see that cortisol, those stress hormones being at a high. So it is really good. Remember, we always talk about having that support team and having the psychologists on board to be able to help combat these issues. So from a physiological point of view, I do see it from urine samples, from saliva samples. You see it when you look at the Borg scale and you ask them, how does a training session that is supposed to be, let's say if we plan it to be not high intensity but normal, that becomes a daunting task for them. So these are things that as professionals, you're working with them, you have to be able to be aware of, and we're going to talk about that later on.
Yes, because given these challenges, how and where could an elite athlete seek professional help?
Well, as experts in the BASES, which is the British Association of Sport and Exercise Science, we see it as the local governing body, that sport body that is in control of the sport, that they should be able to offer a mental health literacy program. That mental health literacy program should really promote knowledge and beliefs about mental disorders, which would aid with their recognition and the management or prevention. But it's not just about just handing out pamphlets and, it is really a strategy that you have to incorporate that would create sustainable approaches for individuals to address and deal with these poor mental health and consequences that related to this situation. It is really a strategy that you can't just only start at the elite level. You definitely have to start it for those amateur and young budding athletes. So it becomes a process.
Yes.
And that's the word I'm looking for.
Yeah.
It's a process that has to take place with this strategy. So it's not just because it happens, you want to be able to involve or incorporate it now. You really want to create a process that, from a young athlete, you are able for your own self to identify, recognize, right, and manage it as well. But also the support staff. Because we are not excluded from it.
Yes.
Sorry, go ahead.
Now, I was just saying that you mentioned psychologists working with the team, and you mentioned mental health literacy strategy for athletes, yes, with the under the governorship of, let's say, the state, for example, through the programs, right?
Yeah, so like if you have, for example, football, so it means that, like an example, TTFA, which is the governing local body for football, they're the ones should be able to provide for their elite athletes, amateur athletes, a mental health literacy program.
Right.
And as I indicated before, this program should really be a strategy, and that strategy should really be a process that not just only involves the elite athletes, but as well involves those budding athletes that you have amateur, so that it's not just a one-time thing. It is across the board. So it allows them to consolidate the skill of recognizing it, managing it, and preventing.
And that's the point I was going back to when you mentioned that usually they would have a psychologist working with them, helping them to build their minds, because somehow we think of elite athletes with very strong minds that would allow them to survive and thrive even within a pandemic, for example, when they can't access what they're used to in terms of facilities and training and coaches and that sort of thing. Is that what usually would happen? That they are able to thrive beyond, even if they don't have the support services that they would usually have?
Well, this is what I always say. Remember, athletes, whether you're elite, amateur, in between, you're a human being first. And sometimes the challenges, not sometimes, most times the challenges are overwhelming. You can imagine being in a sport or being from a country where you don't have financial support, you don't have the gears to do your sport. You know you're good at your sport, and then you go and you see other teams and you see other countries are well supported. That in itself brings on a level of frustration and stress. So and you see it. I could tell you, because being in the lab space, actually taking samples, you could see, but where this comes from,
right? Yeah.
Sometimes even before, obviously competition brings on its own level of stress. Training itself brings on a whole level of stress. So imagine all of that compared together, and then we expect the athlete to perform. Stress hormones do inhibit performance. So that is something that we need to look at as a country, look at as athletes, look at as administrators, have a level of strategy. I know your psychologists are well trained, and they will know that having a mental health literacy program or strategy would work well for athletes.
Well, Marissa, we're going to have to leave it there. But, I always like to parallel it to, everyone who's watching. I think it's wonderful to have a mental health literacy strategy, just because,
Even in schools.
Even in schools. Or even me, everyone out there.
Yes.
Take a mental health day. Make sure it's so important, especially
do the things you like.
Yeah.
Do the things you like and are passionate about.
Yeah, we can go on and on, but we're out of time. Marissa Gibson Bailey.
Yeah, thanks for having me.
Happy New Year. Thank you so much for joining us. Yeah, wonderful.
Yes.
We see you again next week. All right, that was Marissa Gibson Bailey, their sport and exercise scientist, certified exercise physiologist, and creator of the segment From Playground to Podium.